Good evening, everyone. Sorry about the delay. Hallelujah. Dr. Hines. Yeah, now we have our quorum. And I would like to call this meeting to order. First up is our first opportunity for public comment. Is there anyone online that would like to make public comment?
If you are online and wish to speak for public comments, please raise your hand at this time.
Is there anyone in the auditorium that would like to make public comment at this time? Not seeing anyone, there will be a second opportunity for public comment at the end of the meeting. I'm looking for a motion to approve the board meeting agenda.
So moved.
Support.
It's been moved in support. Is there any questions on the motion? Hearing none, all in favor say aye. Aye. Any opposed? Motion carries. Sheila, can you call the roll, please?
Just a little housekeeping. I didn't know if you want to recite the pledge.
Okay, they put it down after the roll call.
Oh, that's weird. Okay.
First thing.
Mr. Young?
Here.
Mr. Furman?
President?
Dr. Giles? Here. Pastor Jones?
Yes, I'm here.
Dr. Guadalupe? She is en route. She just let me know. Ms. Woodruff?
Present.
Dr. Hans? Here. Ms. Newman?
Here.
Ms. Rue is not able to attend. Ms. May? Mr. Torres is also en route. Mr. Cowan is not able to attend. So you have quorum.
Thank you. And can we all stand for our Pledge of Allegiance? Now we're going to have our stories to inspire hope. We have to flip-flop a couple things. The Abilities Champion.
Good evening, everyone.
Good
Suzanne
evening.
Weiner, Director of Communications and Community Outreach, and it's my pleasure to present our Community Living Services Abilities Champion, PJ DeQueer. DeQueer, yes, thank you so much. I appreciate that. He was honored at our Abilities Awareness event on March the 5th, earlier this month. It was a great festive event, and PJ actually kind of really took the crowd. He was quite a hit at the event. So I'm going to go ahead and turn it over to PJ and Justin as well.
Hi, I'm PJ DeQueer.
I'm Justin Thorne, a support coordinator with Community Living Services. Nice to meet everybody. Do you want to talk about where you volunteer?
I volunteered at Van Heusen Farm. I volunteered at Meadowbrook Theater, where actually I'm a volunteer usher next week.
All right. What play is next week? Not a good one? Oh, thanks.
No, they're usually musicals.
Oh.
And I'm very particular about the musicals I want to stay for.
Okay. What do you do as a volunteer?
Basically, I scan tickets. I help people find their seats if they need that help. usually people know where the seats. I can help someone like someone's on a walker, or I would just ask I would ask the house manager for help at that point, because I don't want to be responsible for them falling.
Yeah. How long do you think you've volunteered at Meadowbrook Theater?
Probably 10, 12 years.
Okay. And I see you've got your Ashley Eiserman shirt on.
Oh, I volunteer with Eiserman. That was my next door neighbor's daughter who passed away in a boating accident. God, when I was a junior in high school. Oh.
So what kind of volunteering do you do for the Eiserman
I
Foundation?
basically put up loaner boards where they loan out life jackets if you don't have one.
So at different docks, people might pull up. They might not have brought a life jacket, and you've just made sure that one was left there in case they need it, right?
Sometimes one time I helped Mrs. Eiserman pick up a delivery, but these canvas life jackets, to put it mildly, were all rotten.
Yeah.
And nicely, it stunk to the high heavens.
Oh my goodness.
Yeah.
So part of the volunteering is the smell test.
No. No, it's not the smell test. In that case,
It's the maybe it's not going to be left out test, right?
Exactly.
Exactly. So where do you take some classes at?
I take classes at Oakland, where my mom sets them up. I have great professors. If anyone you support wants to do that, you've got to get in with the right professors, and I prefer history and art history classes, but I really prefer art history because they show more images.
What class do you want to say what classes you're taking
I'm
now?
in, I don't remember the class number, but I'm in witchcraft and occult sciences in early modern Europe. I love the professor.
Yeah, and your professor, she sometimes comes to your
Meetings.
your meetings. Which meeting in particular?
The plan meeting.
Yeah, so you have a lot of people who come to your.
Like 30, sometimes 35.
Sometimes you need more than one table to host how many people come to your plan meeting. Yeah.
Literally, sometimes 30, 35 people show up. We have plenty enough food for.
Yeah.
Dinner is in the meeting provided.
Yeah. So are you inviting the board to come to your plan meeting, or what do you think? You got to think about it. Maybe.
Okay.
Okay. Who else comes to your plan meeting besides the professor?
A lot of my support network comes.
Yeah.
My former next door neighbor, the Smith.
Mm-hmm.
Mrs. Eiserman.
Yep. So neighbors, friends, professors, staff, former staff, just all these different community members come out to help you figure out what your goal is going to be and help you really feel like how can you express yourself the best, right?
Oh, yeah.
And one of the ways you like to express yourself, I know that we came, I think, in this room a couple months ago to come to a group.
We came to the advocacy working group meeting.
Yeah. Do you have any questions about that?
When's the next advocacy working group meeting?
Soon. I know that it's really important to you that you want to make sure that when the date's decided that you can be there, because different advocacy groups and opportunities like this mean a lot to you, right?
Yes.
Yeah. I mean, PJ said an emphatic yes both times that he was offered to have an opportunity to be an advocate and speak. I can say that, right?
Exactly.
Yeah. So we talked about that you volunteer and that you...
I work with Dutton Farm. I work with the Rochester Hills Public Library through Dutton Farm.
Yeah.
Which, if you need to direct anyone to job development services, definitely, I recommend Dutton Farm wholeheartedly.
Yeah. So you volunteered and you take classes and you be an advocate and you put all that together and you said, I want to get a job and I want to do something in the community, and now you're an employee of the Rochester Library. Yeah.
Rochester Hills Public Library.
Yeah. What do you do there?
I'm a shelver.
Yeah.
I would bring out my name tag, but,
You have it?
I do, but I don't want to lose it.
Maybe you just kind of pull it out for a little bit.
Nah, I'd rather not because I don't want to leave it here.
Well, I'm not responsible enough to hold it,
No,
so.
Yeah, don't want to take any chances with
Okay.
that.
Well, it's really important to you, so I can understand that.
Yeah,
How many days a week do you work?
2 days.
Yep.
Tuesday, Thursday, 9 to 1.
Yeah. And since you started working, which is brand new, did you stop
About 10
volunteering?
months.
10 months. Do you still volunteer or did you stop?
We haven't volunteered at the museum in about a year
Well.
because they haven't had anything for us to do.
Yeah, but you still do the ushering.
I love ushering.
Yeah.
The one play every year I stay for the whole thing is the Christmas Carol.
It's a strong endorsement. So you still volunteer, you're still taking classes, you're still an advocate, you just put all these things together. And there's one other thing that we talked about last time that's on your list, something that you help your mom with.
Also in April, which I think Justin is going to be at.
Yes, I am an attendee of Authors in April.
Uh,
But you're a contributor. You help your mom make sure everything's organized, or as you call it,
I'm the errand boy.
you're the errand boy. You want to tell them more about what being the errand boy means?
I deliver books to people, or but the nice part is one of the days I get to go to lunch with them.
With the authors, right?
Yeah, that's fun.
Yeah. So Authors in April is an event that's held in some of the Rochester schools where
All of them.
various authors, all of them. They bring in authors from different parts of the world, and they meet kids in the area and teach them about writing and expose them to the experience of it. And your mom is one of the chairs of that organization.
I go see all the presentations usually.
Yeah. I know that there's a lot of books in your mom's house when that's coming up. I know you help move them around.
Gosh. Yeah, like 5,200 books a year come through the house, and I'm thinking, will it ever end?
How many do you get to carry?
Well, when there's huge pallets, I usually let someone with a little forklift bring them in.
All right.
When you get 5 pallets of books.
Yeah, forklift would be nice. Is there anything else you wanted to share? Or do you we talked about maybe giving the board an opportunity if anyone wanted to ask you a question. You want to do that? If anyone wants to ask PJ anything else about anything else he does, we figure it would be good for that. Over here, I think we have a question.
The one I'm in right now is it's Witchcraft and Occult Sciences in Early Modern Europe.
Is that your favorite of all time?
Yeah. It's my favorite right now.
Okay. All right. Oh, maybe over here.
One more question. Hello. So you mentioned that you really don't like musicals, but I'm just curious, is there one that maybe you would recommend?
Yeah. There was one I wanted to go back to, but I had a suit fitting for my brother-in-law's wedding that I had to go to the day I chose, so I couldn't go back to it. And I cannot remember the title of it as well, but I will give you a plug for the play version of To Kill a Mockingbird.
Okay.
It's really hype. It's really about the hype you get.
Okay. All right. I think you want to. Guess we just say thank you. Just, what do you think? How do you keep up with all the activities you do?
Sometimes it right around the last week of April and the first week of May, usually it gets.
Or around Authors in April, yeah.
Yeah, I guess career. My house is insane.
Yeah.
Totally insane. there's people coming in and out, there's boxes of books coming in and out, getting signed.
Yeah, I think, when we think about the people that come to PJ's meeting and the people who choose to be involved in his life, it's the support circle and the amount of people and the quality of support and the investment in him is all the potential. Because I think when we originally talked about maybe you're ready for a job, we were at one of your plan meetings and everyone there was like, you can do this. And when you have like a support network and national supports and clinical supports and great staff, like you could do so many things as evidenced by PJ. So, yeah. Good. Thank you so much.
First up is our Finance Committee update.
Good evening, everyone.
Good evening,
There we
Robert.
go. So we're going to go through the financial report for January, and this has been shared with the Finance Committee, and we also reported at the Committee of the Whole recently. We'll start off with our MDHHS payments, which are a facsimile of our overall revenue, and you can see a slight downward trend each month from October through January. We're hoping that there's some relief on the horizon, but nothing official as yet. And in total, our overall revenue is actually up a little bit from the prior year. In terms of our overall eligibles, you can see that that is relatively flat, and I would point out the change in the DAB versus TANF, and we know that that's been an ongoing challenge in terms of how people are classified for purposes of funding. And movements out of DAB have a negative impact on our ability to garner funding. They're funded at a higher rate than the other categories that folks are being reclassified into. A look at our balance sheet on the asset side will show that there's been a little bit of a shift in terms of our cash and our receivables. Our cash is actually up a little bit through January relative to the prior year, and our receivables are down, which just means that we collected money a little bit faster. In total, our overall assets are down a touch, and we'll talk more about that. And on the other side of the balance sheet, on the liabilities, you can see that our payables are up a tiny bit relative to the prior year. And then our overall net position shows a decrease of relative to the end of the prior year, from $29,488 to about $22 million. That's roughly a $5.8 million contribution to the deficit. As referenced in the conversation about our MDHHS payments, you can see that overall our revenue relative to last year is up a little bit, even though the trend is a little bit downward. And that's about a 10% increase. And on the expense side, you can see that our overall expenses are up a touch more than our revenue is, contributing to that deficit that I referenced. And then our overall net income is a contribution to the deficit of about $5.9 million, which is $1 million better than it was same time last year. So some improvement, which is good, but still much work to be done. Our standard review of our top 15 providers, no significant changes there to speak of. And before we go to questions, I just wanted to note some of the actions that are being taken strategically by the organization. And perhaps one of the most significant ones is our transition away from the service models and into fee-for-service funding. And I'm happy to say that we've made a lot of progress in terms of rate development, and we're moving to final approval of those rates. We will be communicating with the providers and getting feedback. And our overall financial position, I believe, will improve when that's fully implemented. So I just wanted to offer that as context. And I'm happy to field any questions.
This kind of a question for Robert and maybe Dana. From the state, any sense on rate changes before the end of the fiscal year, or are we kind of where we're at for the next several months?
There's been no indications one way or the other in terms of where rates are going. We are expecting funding for the mandate related to ABA services. But outside of that, in terms of overall systemic funding, there hasn't been any overt acknowledgement of the challenges that are being faced. And I can tell you that many of the PIHPs are projecting significant losses this year.
So then related to that, any word on the nearly $53 million that the state was holding back from last year's budget?
A few months ago, we sent a letter from the Tri-County Board chairs, Mr. Cohen, Mr. Kraft, and Dr. Tagg in Detroit Wayne. And in response to that letter, the director stated that funding would not be made available because the overage was not attributed to Medicaid covered expenses. And I believe they were, and I believe the other two counties believe the same. So right now, it doesn't look like we'll have any opportunity to get that funding. So we continue to advocate to see if there are ways that, because that really could have assisted in the deficit multiple PIHPs are seeing. So we continue to advocate. We continue to advocate for the rates that are appropriate to the services we're providing. And we know healthcare costs have gone up in all arenas. And so it's an interesting time because we've been told in response to some of our questions about the funding and the rates at the state level to contact our legislators. So we're doing that as well. And I think you all are aware of a survey that's coming out, or that is out currently from the state, asking about the services. And they don't directly ask about the PIHPs because I really don't think people were served really care about what we call ourselves. I think it's more of, do I get to go to the provider and the doctor and the treatment team and the community service I want? Is that being provided? And we do an annual needs assessment, and you're going to hear about the outcomes and results from that in the coming, I think next month it's on the agenda. But in terms of the funding overall, we're not making a lot of movement in that area. So we have to, like we just started last year, do those internal things to manage our expenses and our costs and really take some controls in that area. And we're doing that.
Thank you.
Yeah, two questions. One, earlier or mid-year, near the end of the year, we were receiving X number of dollars from the state. Those, I think it's like $1 million or whatever. Has that run out now? That was like extras that they were giving, and I shouldn't say extras, but
I'm not entirely sure what you're referring to, but I can say affirmatively that we aren't getting any extras of anything.
It was a rate adjustment.
A rate
that
adjustment.
summer,
Oh, it's okay.
Yeah, so
It ended September 30th.
Yeah, it is September 30th, okay.
I do think that historically there has been sometimes, not every year, right, mid-year adjustments that occur, and I am not aware of any indications that that's something that we should be counting on this year.
Okay. And yeah, I agree that we shouldn't count on it. I just wondered when it would run out. The hope is that maybe that'll happen again. The other thing, since we're working on that rate adjustment, that seems to be going along pretty good. Your expectation, would that help us in relation to improving on our deficit?
Ultimately, that is the goal, and we need to be sensitive to the fact that we're going to be managing within the resource constraints that we have, and that has implications for the network as a whole. So in order to get out of the deficit situation that we're in, we have to spend less than we have been.
And that's my concern. You know, looking at the fact that we would do the rate adjustment or what have you, that's not going to work the miracle, you know, for us as far as getting us totally out of debt. And so all of a sudden we start moving up the line versus below the line.
No, I think that the goal is to have better visibility, better transparency into exactly what services we're paying how much money for. So just for clarification, the rate initiative has been to establish rates for specific codes, for specific services that providers are providing, and then reimburse those providers based on the codes that they submit claims, the services that they submit claims for, on a per unit basis, like paying them on a per unit basis, as opposed to the service models, which was more of like a bundled approach, where we would pay for a menu of services, and any services that happen to be used in that menu would be reimbursed through the service model.
And I think from discussions we've had, other places, other counties have been able to do that rate adjustment without a lot of pushback from the providers, if you will, if I'm correct.
I can't speak to...
You're mixing two rate adjustments.
Am I mixing two?
So the state, just to clarify, then I'm going
Right.
to speak up. So April is mid-year. So with hopefully the state, and so everybody listening, talk to your state senators and state reps, that's when last year the rate adjustment kicked in, which gave us $1 million a month for the rest of the fiscal year. Our fiscal year ended, we kind of rebase. That's the state rate adjustment. The other rate adjustment is changing the model.
Right. The other rate adjustment, or I would call it standardizing the rates and setting our payment model to a fee-for-service, moving away from the service models like Robert explained. The fee-for-service pays for those services that are provided. The other thing about that is that we opened and started a claims department where we would officially adjudicate claims and then tell our finance department to pay those claims because they're good, or we can send them back to the provider to resubmit because there's some sort of error. What it does is allow us to actually know how much we're paying out for those services, because we also found that some providers are at higher rates than others for the exact same service, the same type of environment in which those services or settings in which those services are being provided. So we wanted to make sure there was equity among the rates, right, standardize the rates, and then we could better manage our financial analysis in front of it instead of behind. And the other thing that it does, the other thing that I'm thinking, let me think. Oh, when we said this, remember when we started this whole process too, we knew that there would be some providers that would have improvements and some providers that would, you know, be concerned that their rates went down, but it would equalize the rates across the provider network. So that was really important into managing by fund source. And that's another big part, Medicaid is always the payer of last resort. So if we have other resources and funds that we receive, those should be pulling from those accounts first, and Medicaid should always be payer of last resort. And so we'll be better able to manage by fund source when we do the standardized rates, when we have claims adjudication, we can pull from the various accounts as we should.
And that then too is what other counties are able to do.
Absolutely.
And it's been accepted.
Absolutely. And there will be, I'm glad you brought that up, because there will be some approvals we will need to get from the state as it relates from moving from service models to a fee-for-service environment.
Thank you.
Any more questions for Robert? Thank you, sir.
Thank you.
I'm going to make another change in the agenda.
Ms. Newman, can we do a vote for receive and file of the financial reports through January 31st?
Oh, I'm sorry. We have to vote on the financial report.
Just to receive and file the report.
Okay.
Motion and everything?
Yes.
So I'll move to receive and file.
Support?
It's been moved and supported. Are there any questions about the motion? Hearing none. Can we do it with the, you have to do a roll call? Okay. All in favor say aye.
Aye.
Any opposed? Nay. Motion carries. Thank you, Sheila. And now I want to go back to item number IF, Board Member Service Recognition. Mr. Torres, you mind coming down? This is going to be your last official board meeting, so we want to recognize your contributions that you made. Would you like to say anything?
Yeah, sure.
In the mic.
Yeah. Want to stand with me, Melchiah? Sure. Yeah, come on out front. I can say something back over here. Yeah, I just wanted to thank everybody for the recognition, and I hate to leave the board after 2 terms, but if I look back on the time that I served on the board, I spent nearly a decade of my life serving OCHN. I first started out when I was about 27 years old. I was just a young, bright-eyed kid and really innocent, and I was reading the Oakland Press one day, and I opened it up, and I saw in there it said, interested in serving on boards. One of them was the Oakland County Community Mental Health Board. At the time, I was working in the court system. I was just starting my career, and I worked in probate court, and specifically for the chief judge of the probate court. And one of the things that we did often was mental health transports. We also had a criminal division that we worked with as well, and I saw a lot of intersections between individuals with mental health issues and those in the criminal justice system. And I knew that there were a lot of problems in the system, and I felt that the system in many ways wasn't working. So I figured I'd get on this board, and this is where, this is where it's at, and this is where you can change things. And getting on the board, I began to realize that, you're just one board member, that you can't really change everything, right? And it was a little bit of the school of hard knocks when I first got on in my first term. Maybe not everybody knows, but some of these board appointments can be tremendously political. So when I first got appointed, I certainly ran through the ringer through the Board of Commissioners, but I stood my ground and I was able to get on the board. When I went for reappointment back then, wasn't reappointed, but then a few years later I came back and was able to serve these 2 terms. What I learned the second time, by that point, I'd already been an elected official and serving on my school board and doing other things and further in my career, was that as one board member, you don't make the vote, you don't make the decisions, but you can have influence. And I think that's one of the things that I've always tried to do, whether it was liked or not liked, was to have influence in my position here. And at the end of the day, regardless of what influence we're going to have, we're here for a reason. It's to speak our voice and to make our interests put forth. Whether they're adopted or not is another thing. But I think one person can make a difference and can have influence. I've appreciated my time serving on the board, serving with my colleagues. I think the only other person that was on the board the first time I was on that's still here is Melchiah. And I think everybody else here is, everyone else is either not on the board anymore, or unfortunately, Dr. Taub was another one that I served with early on who recently passed away. But I am very appreciative of my time here with OCHN. I really have advocated for what I believe to be the truth. I think everybody here is great individuals, and you're all striving to do the best that you can, and you want the best for those that we serve. And I'm appreciative to each and every one of you for it. So I thank you for the opportunity to serve. I'm sad to leave the board, but I'll always have fond memories and remembering what we were able to do together collectively. Thank you.
Thank you, John Paul, for your 2 years of service, or 2 terms of service. Now we are going to do our board approval items. The first one is WDIV and WXYZ. Suzanne?
Good evening again. Just a little refresher from last week. This is our renewal for our television advertising contracts. This is for Channel 4 and Channel 7, and previously they were 3-year contracts, so we are requesting an additional 3-year contract for this. We did reduce the funds by $10,000 each year, so the total for both contracts is $240,000 for the 3-year period. Just as a note, I know the board requested to be able to see some of our commercials. Those are posted on Boardable. They're in the communications document section, so I'll post a message to give you instructions of how to get to those and view those. That's all.
Does anyone have any questions for Suzanne?
I'll make the motion for approval.
Support. It's been moved and supported that we adopt the contracts with WXYZ and WDIV. Are there any questions? Hearing none, can we have a roll call?
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans?
Yes.
Mr. Torres?
Yes.
Ms. Newman?
Yes,
Motion carries.
thank you. And next on the agenda is the CG.
Surge is what we
Surge
kind of call
contract?
that. Yes. This is a SAMHSA grant, SAMHSA Emergency Response Grant, and this is an advertising or countywide marketing outreach campaign. It is a little bit focused in on the Rochester Hills community and that surrounding area following the shooting last summer. So it's a targeted response to have them help make awareness for our crisis response line, as well as OCHN services for behavioral health needs. So it's a combination of a number of different things as noted, with some television, cable advertising, some direct mailers, small theater displays, as well as a targeted mailing to Rochester Hills community with some information as well.
I'd like to entertain a motion to accept the Surge contract.
So moved.
Support. It's been moved and seconded. Is there any discussion on this motion? Hearing none. Sheila, could you do a roll call, please?
Mr. Torres?
Yes.
Dr. Hans? Ms. Woodruff?
Yes.
Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Dr. Giles?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Ms. Newman?
Yes,
Motion carries.
thank you. Thank you, Suzanne.
Thank you.
Our next contract is the CMHSP Contract Amendment Number 1, Kalana Ali.
Good evening, everyone. Kalana Ali, legal counsel for OCHN. Before you tonight, we have the CMHSP contract amendment. It's a non-financial adjustment to our contract, but does provide for updates to the attachments to the contract, which requires us to make some changes to our standard operating processes. Those have been vetted by our administrative team and will be appropriately implemented. If there are any questions regarding this contract, I'm happy to answer them at this time.
And entertain the motion for approval.
So moved.
Support.
It's been moved and supported to approve. Are there any questions on the motion for Ms. Ali? Hearing none, can we have a roll call, Sheila?
Mr. Young?
Yes.
Mr. Furman?
Yes.
Dr. Giles?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Ms. Woodruff?
Yes.
Dr. Hans? Mr. Torres?
Yes.
Ms. Newman?
Yes,
Motion carries.
thank you. Next up, we have the Doshabo contract with Tricia Zumbo.
We actually have our Director of Training, Jean Fentner, here
Oh,
today, who
okay.
is going to present on that.
Good evening, I'm Jean Fentner, I'm the Director of Training here at OCHN, took that job over from Tricia, who is now in a wonderful new role. This is a renewal of our 2-year Doshabo Learning Management System contract. The learning management system has been in place since, I believe, 2022, 2021. Has had a dramatic increase. So this is a 2-year renewal, and we are also, as part of this contract, requesting an increase in monthly users from 1,000 to 1,500 users per month, for a cost of just under $154,000.
I entertain a motion to accept the contract for Doshabo.
So moved.
Support.
It's been moved and supported. Are there any questions on the motion? Adam?
Yeah, I just have a question regarding the increase in the number of users. Where do we think that may come from?
We know where that comes from. When Doshabo was brought in a couple of years back, it only was designed to serve Oakland County staff and our immediate contractors and volunteers. In the fiscal year 24, we brought in the training contract from one of our external providers, and that training contract in January of 2024 had 149 users, and today it has almost 8,000 users. And so we get charged in Doshabo by who accesses per month. So you could access in March and take 1 class and we get charged, or you could access in March and take 10 classes. We still only get charged for you once. So we have now, well over 8,000 people that are accessing our system, with a total of actually about 11,000 users in Doshabo. That includes not just the direct support professionals.
Okay, great, thank you.
Are there any more questions from Ms. Fentner? Sheila, can you give us a roll call, please?
Yep. Mr. Torres?
The same person every time.
Dr. Hans? Yes. Ms. Woodruff?
Yes.
Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Dr. Giles?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Ms. Newman?
Yes,
Motion carries.
Thank you.
Thank you.
Next up, we have Suzanne with the Mental Health Awareness Proclamation.
Hello again.
Hello.
As in the past, we have our May as Mental Health Month proclamation. We're bringing it to the board this month because we want to have the opportunity to be able to send it out to our local cities, villages, and townships, as well as our school boards and faith-based organizations.
Excuse me, Suzanne, can you switch mics because there's something wrong with that one? Yeah, it's a lot of distortion.
Okay, is this better? I think that's better. Okay, where was I? We are bringing this to the board this month because we want to have the opportunity to send the proclamation out to our local cities, villages, and townships, as well as our school boards and our faith-based organizations to have an opportunity to be called back and maybe accept the proclamation. Sometimes they hold their meetings in April, either early in the month of April or in May. Early in May, we want to have an opportunity to be able to be present to accept some of those proclamations. Sometimes they do invite us back. So I'm presenting the May as Mental Health Awareness Month proclamation to the board. I don't know if you'd like me to read it or if you just, I think everyone has reviewed it, but if you have any questions, I'm happy to answer.
I'll move for approval.
Support.
Just over here. I would appreciate if you could read it. It just always is good to hear out loud. I know that we know, but there's people who are watching and, you know, it's videoed and all of that. So it's just, it's a good resolution. I think it has power.
I am happy to read it.
And I have a question too on that. I know that our chair mentioned getting that to the proper persons in the city to make that, and I don't know if you have a list of those persons or not, because many cities, you send something to them, it just goes into their email and we may miss it. Do we need to supply you with a list of the persons who you could send that to so they can announce it, i.e., the name of the president of the council or the mayor or whoever, so that it is publicized during their council meetings and then that it is posted online?
Yes, we actually do. We email it as well as do a hard copy mail for the proclamation, so that I think it is feedback with your, so that it is getting to them in a number of different ways. But yes, if there are contacts that you would like it to go to specifically, you can let Sheila know, and we can make sure that it gets to those contacts, and then we can circle back with any board members. I know Mr. Cowan had already volunteered that he'd be open to accepting the proclamation for the Royal Oak community, and most often we do get a proclamation back from that community. So if there are contacts, please feel free to provide those to Sheila, and we'll make sure we get them the proclamation with the information.
I'll raise my hand too to give it in Pontiac. Okay, is it?
And I'm just wondering, Micaiah, if that would be, with all of the experiences that you have had, because I'm talking right, all the experiences that you had, and you're such a great representative, not only of this board, but also of the work that you've been doing in the area of mental health, if when that proclamation is made, that you would present that to the city, I think it would have a little bit more impact, you know, by the populace. I don't know if that's possible. I'm going to put you into something, but I think it would really be great.
That'd be fine. Thank you, Dr. Jones. Pastor Jones. You've been promoted. Do we have any comments or questions? Sheila, can you give us a roll call vote, please?
Did you want me to read the proclamation? Yeah.
Oh, read the proclamation. I'm sorry.
That's okay. Okay, Mental Health Awareness Month, May 2025, whereas mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. it also affects how we handle stress, relate to others, and make choices. And whereas mental health is important for all individual well-being and vitality, as well as that of our families, communities, and businesses. And whereas nearly 1 in 5 American adults will have a diagnosable mental condition in any given year, and more than 42.5 million U.S. adults live with anxiety disorder, the most common mental health condition in America. And whereas May 1 through May 31, 2025 is recognized as Mental Health Awareness Month, Mental Health America, MAHA's 2025 theme is Turn Awareness into Action, which celebrates the progress we've made in recognizing the importance of mental health and provides challenges to turn understanding into meaningful steps towards change. And whereas Oakland Community Health Network, OCHN, joins our national partners in promoting this year's Turn Awareness into Action campaign. And whereas mental health management ensures that individuals can focus on their abilities to live, work, learn, and fully participate and contribute to our society while promoting diversity, inclusion, and acceptance. And whereas improved systems of care for vulnerable populations, access to non-emergent and crisis services, advanced integrated physical and behavioral health care, along with provider relations, helps to fortify services coordinated by OCHN. And whereas OCHN and its service provider agencies are committed to inspiring hope, empowering people, and strengthening communities. Now therefore be it resolved that Oakland Community Health Network hereby recognizes May 2025 as May Mental Health Awareness Month. OCHN calls upon our citizens, government agencies, public and private institutions, businesses, faith-based organizations, and schools to recommit our state to increasing awareness and understanding of mental illness and the need for appropriate and accessible services for all people with mental illnesses to promote recovery and higher quality of life.
Thank you, Suzanne. Are there any more questions or comments? Sheila, could you call the roll, please?
Yes. Mr. Torres?
Yes.
Dr. Hans? Yes. Ms. Woodruff?
Yes.
Dr. Guadalupe?
Yes.
Pastor Jones?
Yes.
Dr. Giles?
Yes.
Mr. Furman?
Yes.
Mr. Young?
Yes.
Ms. Newman?
Yes.
Motion carries.
Thank you. Next on the agenda is the consent agenda, and we just vote on these.
Move for approval.
Support?
It's been moved and supported. Are there any questions on the motion? Hearing none. We don't need a roll call for this one, do we? Okay. All those in favor say aye.
Aye.
Aye. Any opposed? Motion carries. And that takes us down to other business.
So there's a couple of things. A reminder that the Metro meeting is next week for Thursday in place of the study session.
27th.
The 27th, yep. It says the 20th. It's the 27th, yep. So I also want to, Macomb is hosting next month or next meeting, and they're throwing out some dates and wanted to get board input on some possible dates in June. So I wanted to see your guys' input. Normally it's on the study session. Let me see. Oops, sorry. It is, the proposed dates are June 26th, a Thursday, or June 24th, or July 24th, which is also a Thursday. So right now, I think those both hit study session dates. So does the board have a preference?
Sheila, what were those dates again?
Which doesn't make sense, because it says June 26th. Oh, yep. 26th is a Thursday, which is a study session day.
July 24th.
And, hold on, I gotta get the calendar up.
Or
And July 24th,
Either one of those days.
which is
good for me.
not a study session day because there's 5 weeks in that month.
Mm-hmm.
And we moved the date to the 31st.
Okay.
So, to the 5th week. So does the board have a preference, or you want to allow them to schedule, or would you prefer to keep it on a study session date?
Good either way.
Fine either way.
I also want a reminder, like, July study sessions are, like, not well attended. Do you know what I mean? So just keep that in mind. So,
Okay.
of June? July? Oh, okay. Yeah, if the 31st gets canceled. And typically in June, study session date, this is weird. The study session date is typically the board budget and review of the budget for next fiscal year, and you guys usually handle some pretty good business at the June study session date. So I don't know if you really want to defer those topics.
No, let's go with July. I think that's better. Yeah, 24th.
Okay. I'll let her know. Thank you.
Thank you, Sheila. Next, we have board reports. Recipient rights, Dr. Guadalupe.
Yes, thank you. So the last committee meeting was held on March 6th, at which time the committee elected a chair and vice chair. We continued to review the rights handbook, which we were all provided tonight, and we'll continue to do that. We go like 2 to 3 pages each meeting. We reviewed the dignity and respect policy, discussed an open seat that will come open very shortly. I don't recall when that opens, but they are accepting applications. And then the committee wanted the board to know that there was a lot of positive feedback from the needs assessment. So a lot of the committee members talked about the positive impacts of clubhouses, the positive impacts of their case managers, and the relationships that they build with the case managers. There were some concerns brought up regarding challenges with the Medicaid spend down, that some individuals had a very high amount, up to $1,600 or more, which was definitely impacting their ability to live their lives, pay other bills, because they were kind of pushed into service decisions based on their Medicaid spend down. So they wanted that brought up. And then some of the other concerns were that some of the individuals were automatically being enrolled into certain plans with commercial and Medicaid plans, and some were being forced into particular Medicare plans if they had a Medicaid plan as well. So that was it, and thank you.
Are there any questions for Dr. Guadalupe on her report? Hearing none. I guess we don't have our other two people. Okay. Next up is our second opportunity for public comment. Could you check to see if there's anyone online that would like to speak to the board?
If you are online and wish to speak for public comment, please raise your hand at this time.
Hearing none. Is there anyone in the room that would like to address the board at this time? Seeing none. Thank you. It's time for the director's report.
Good evening again. Dana Lassenby, CEO. I just want to highlight a few areas and then also align my report with our strategic priorities and plans. First, I want to thank our team and the community for our abilities awareness celebration. And as you heard from PJ DeCoeur earlier today, really that's what it's all about, to highlight the amazing things that people are doing in our community. And this event was a resounding success. I hate that I had to miss it for another engagement and event, but I wanted to thank the team for what I heard was such an amazing day and celebration. We, along with PJ, also celebrated Lisa Barger. I hope I'm pronouncing her name correctly. We also had a speaker, Alex Kimmel, who highlighted the importance of self-determination. which is something that we prioritize here at OCHN and are working diligently to make sure that self-determination is growing and is supported, and working with the fiscal management service and those programs to make sure that, again, the rates are standardized, equitable, and also that those services are continued in a way that truly supports choice and that people have access to the services and supports that they want and need. We also had a speaker, our MC was Fox 2 morning anchor Josh Landon, and he's been with us many times before and also is a huge advocate for the behavioral health and mental health community. So it was great. I believe somebody was supposed to do it, but we ended up with Josh coming in and supporting us in this event. So in terms of our strategic priorities and the things that we work on, our annual needs assessment is still in process. We're getting in those numbers and those reports. I want to thank the team for taking care of that and going out to the various places where individuals are served and getting their feedback firsthand. I know our COO is out there working in the community, as well as our customer service queen, I call her, Miss Linda, of course, and then all the others on our team that are out there in the community and really working with individuals we serve to get their response and feedback firsthand, which is really important. So along with that, what we'll do with that information, and it sounds like we may outperform our responses from last year. I hope that is the case, because we always sort of, think hard before we get all those things back, and at the very end we end up finding out that we do better each year. So it says a lot about our ability to get out into the community and really engage. But I want to talk a little bit about access and our crisis expansion and improving access. So what it looks like, I was just going to show you a vision of what that looks like and how we're really doing that, because I have numbers in the report, as you can see, but I want to show you the trends and tell you what it really should look like when we talk about access. And some of our efforts to expand access have been working with the Oakland County Health Department and opening up an access point in Southfield in that health department. So we have a person that is working there. I believe she started maybe this month. Is it she or he? He, thank you. I knew it. I was trying to remember. But he started this month, and that will allow individuals who show up at the Oakland County Health Department for various services and supports and community education to actually access mental health or behavioral health services there in that office as well. And then also our partnership and continuing to work at looking at ways to fill in gaps in our crisis service array. And one of the things that we're doing currently and working with Honor and the Oakland County Health Department again and Oakland County Exec is looking at our walk-in center, which is currently in Pontiac General Hospital in one of the administrative parts of the building, and that will be moving to a location in Pontiac, which will really be an integrated urgent care. So this is probably one of the first in our community that is truly an integrated urgent care, and so there are other things that we're going to do to expand access and make sure that we are, again, filling in gaps for our crisis services. So that's an amazing partnership. It's through part of the funds come through the county, and they got a grant from the state, but other funds have come from the Penske Foundation, who gave $1 million to have that program and support that. In addition to that, it also is a portion of it to support, I believe, first responders who are in need of support when they are experiencing their jobs and responding to the community in need. So that's a huge way that we can expand access and make sure that people have the services that they need and when they're needed and where they're needed. So that is one of the goals, is to really look at the points of access throughout the community and expand on those. So there's no wrong door and people can actually get screened and assigned to those services. And as you know, we also have services at the RCC, the Resource and Crisis Center, through our partner Common Ground, as well as New Oakland with the Youth and Family Care Connection. And we're seeing differences being made there as well, especially in the children's area, where we're able to divert children from the area hospital EDs into actually receiving services when they show up at the RCC, but also making sure that they can begin treatment early on, and then also return to the community and stay in the community if able. The other thing I wanted to expand on, and I talked about it a little bit, is really the integrated care efforts that we're making. And that is, again, one of the things that we're partnering with Honor Health to do to make sure that people are getting those health care benefits. But also our providers are doing an amazing job through their CCBHCs and making sure that there's integrated care there and that the health care, physical health and behavioral health are health care and they are being addressed. And then the other thing in terms of looking at our systems of care, often, again, when we look at our needs assessment, we see there are gaps. And how do we fill in those gaps when we don't have all the partners at the table? So the last few weeks we have used our time, many people on our team have used our time to go to community events and talk about our school mental health navigators, talk about our veterans navigators, and even last week I had an opportunity to attend the Southfield Public Schools Superintendent State of the School. So that's a lot. State of the District, I should say. And in part of that presentation, which was really amazing and highlighted a lot of private-public partnerships that are really benefiting that district, was an opportunity for us to also engage with the school even further in talking about our behavioral health threat assessment and management. So meetings will be coming up with that superintendent and with that district, as well as meeting with the Oakland County superintendent was also there. And so they provided an opportunity to really highlight some of the things that we're doing here and further our access and really build on that system of care we're talking about for our children, for our youth and families as well. And some other things happened today that I'll highlight next month, but it's really exciting when we're able to get in front of the community and really talk about our services and supports and our amazing network of people who provide those direct services and supports. So the other thing has to do with our providers. I'm happy to see the ARC is in the room and consistently in the room, and that's a good thing. And then sometimes we have other providers that are here, and many are on the line, but we're taking extreme efforts to make sure that we're talking to our providers, building those relationships, because when you mess with rates, or not even mess with, but when you're trying to modify and change and do some improvement of rates, sometimes it can be stressful, and we want to make sure that we're talking to our providers, getting their feedback, letting them know where we are, being as transparent as possible, but really understanding that we're in the position where we have to manage the care and manage our funding sources. So first and foremost are the people we serve, and then we know our providers are critical to that. We can't do it without our providers and working together. So this is not an attempt to cause harm to any provider or any person served, but it is an attempt to improve how we deliver and manage those services and support. So just want to be very transparent about that. I know there are some tough conversations we've had, some tough conversations that we will have, but also compromise and working together has really shown to allow us to do the things that we need to do to stay here, to stay around, because I don't want us to get to a point, and I've said this to my team, where we can only provide those services that we're required to provide. So all of the amazing programs we get funding for are not always through Medicaid, and so those dollars could be at risk with some of the things we're hearing, I think, statewide as well as on a federal level. So we want to make sure that we're doing things in a way that we are securing what we do in this community. And some of that means that really managing about our fund sources, but also working with our providers to make sure that whatever funding and dollars we get, they're being pushed out so they can continue to provide the good services that they're providing. And we don't want to get to a point where those preventative services or those things that we do to prevent further crisis or further need are at risk. So again, that is something that's ongoing. Our team has been really great. Robert has left the room, but it's definitely a team effort. Some of our meetings get very fun, I should say, but we're all with the focus of people we serve in mind. And finally, I talk about our workforce, and not just the community's workforce is a constant advocacy effort in terms of direct care workers and direct support professionals or service professionals. And that is something that is also as a concern when we look at the state and the budget. And we know there was a small direct care worker wage increase, but we want to continue to look at that and how we can advocate so that that is a meaningful pay for people who do such a challenging and amazing job, like the gentleman that was here earlier today. You could absolutely tell that he was committed and he cared and he really knew and was a friend to PJ. And that's really what it's about. So again, working with our internal team, making sure we have the resources and the things that we need and the training and other things, trying to stretch people as much as possible. And sometimes I probably get on their nerves a little bit, but that's okay. But we're stretching and making people do more and make adjustments as well. We're not just saying to the community that we have to make adjustments. We're making internal adjustments as well. So with that, I'm really proud of the team and the hard work we're doing from access to crisis, even internally here in Troy. We have an amazing group of passionate people that are willing to go out and work with people. And I don't know how Linda does it, but she, I always call them out. Oh, and I was supposed to announce something too. We have 2 or 3 people who are thinking about leaving us to do better things. They're thinking about retirement. So we probably have a good, 3 weeks or more to try to convince them to not, but I don't think it's working. So Christine Burke will be retiring in April. So we're going to really miss her, and it's going to be a huge adjustment for all of us. And then also Victoria Marble, who works in my office, is retiring, and I think she has, almost 40 years of service? A long time. So, and then Glenda in HR will be retiring, but that's later. I think it's June. So just want to make you aware of that. So we're happy for them, sad for us, but, it's exciting times. So that's all I have for today.
Are there any questions for Dana concerning her report? Dr. Hines?
Yeah, thank you for your report. We have been hearing in the news that Medicaid cuts may be on the horizon, and that's going to make our job harder. From your reports also, the key thing is the fee-for-service model for us to be able to manage our funds in an efficient way, or at least more productive way, certainly. I don't know if it is the denial of the state by saying that the services that some of them that we are providing are not Medicaid covered services. That's what I heard in today's discussion. So I think implementation of this fee-for-service model is critical, because that is how, there are analysts everywhere. There are more analysts than providers, or who really think about the services or how to manage those, how to provide them. And I think coding is the key. I don't think the providers are providers and small, big, medium, they are strangers to codes.
No.
It's just a matter of how quickly we can implement it. Now, this was in your strategic plan for fiscal 23-25, and we are at the end of in that strategic plan period. So I think whatever it needs, we have to get there. Otherwise, we will be hearing the same excuses in the future, and it's not getting easier, at least for the next year or so.
And if I could respond to Dr. Hines, you're so right in that we have a priority population, and I hate to even say that, because how do you prioritize a group of people over another? But we truly do have a priority population, and those are the individuals we are required to serve. And so from there, it goes to less severe needs. And one of the things that happens is with grant funds and other non-Medicaid funds, those are the programs that are more preventive. Those are the programs like we have gotten grants from the county for co-responders or the school mental health navigators. And so, again, I've been in this for 30 years, and for the first time, I see a really, really significant threat to the federal level of Medicaid. And so we've been through this where we've privatization and things like that on the state level, and we've gotten through it. So we're used to that, and we advocate for that ongoing. Even when it's not a hot topic, we're still working behind the scenes to advocate for the public system. But if we don't change how we manage care and manage our funding, we'll only be able to serve those individuals who are, quote unquote, our priority population. And what I get concerned about is like the jail diversion programs and the programs where we have officers trained to divert people from jail and really put them in a healthcare setting where they get the help that they need. And then the other programs that even today going to the Middle Eastern American TV and radio network today and talking about how to access services, but also how to reduce stigma and how to make sure that people feel safe to access those services. A lot of those things aren't funded, but we have to do it. So there are things that are low cost or no cost. We're going to always do those things, but those things that are grant funded, that are not necessarily covered under Medicaid, we try to build our programs so that when those other dollars are gone, we can still bill Medicaid for those services. So it's an ongoing process. And it does take a lot of time to shift our internal workforce as well as external and our providers that we're working with. It has taken time, definitely. And we're not done.
Are there any more other questions for Dana and her report? Next, we have our board member comments. We start with Dr. Hines.
I already made my comment, thank you.
Pastor Jones.
Thank you very much. I was writing my notes on that, so bear with me because I didn't say anything a couple of times, so it may be a little elongated. But let me thank our CEO for what she does. You know, leadership has been defined by who is behind the leader. Leadership is defined by who's behind the leader, and the flexibility that you've given to the staff, to the employees of OCHN, by challenging them to challenge themselves to do a better job. It really shows through the efforts that have been achieved, so I want to compliment you on that. I also want to compliment Suzanne for the stories that inspire, because that touches the people that we serve, what they're doing, how they're doing, and the amount of dollars that we're committing to them. And those stories really show the heart of OCHN. To Robert, and I know he's gone already, but to Robert for his air of confidence, to look at the numbers different, to see something in the numbers that we have not seen before, to give us the assurance that even with what we have, we'll work through it. And to Trish in her newfound position, that's what is the out pounding the beat of the heat of the concrete, to make sure that the word gets out about what OCHN does. You know, I compliment her. And then to my friend who's going to be leaving me, Mr. Torres, who I met as I came on this board. I want to thank you for challenging us to think outside of the box and to strive for success through performance. And that's what you've done to this board and even to the people that work for OCHN. Because even though you're one voice, but you challenged all of us to reach for success. So, Madam CEO, thank you very much for this opportunity.
John.
Thank you. See, farewell to John Paul. And thank you for all the work you did on the bylaws as I was coming on the board 3 years ago. And so every time we have a bylaw glitch, we'll think of you either to praise you or to go, what the? So thank you for your service. Greatly appreciated.
Dr. Guadalupe?
I will just share the sentiments, wishing you the best, Mr. Torres, and it's been a pleasure serving with you on the board.
Yvette?
Thank you, John, for serving with me the past 3 years. I'm getting ready to go into my second term, and I enjoyed the presentation from CLS on tonight. That is one of my favorite parts of the meeting, getting to meet some of the consumers that are served by the agency and looking at how their lives have been enhanced. He was quite a busy young man, as he was, and he was quite honest in his opinions. And we know that the wheels of democracy sometimes turn slowly or sometimes not at all, but we have to keep on keeping on because we have the mission of advocating for those that may not be able to advocate for themselves. Thank you.
I just want to thank everybody again, the staff, the CEO, my fellow board members for the opportunity to serve. I also want to recognize my wife and daughter are here. They're in the back tonight. And, you know, would be remiss without saying that all of us make sacrifices to our families. Oftentimes my daughter wonders where I'm at. And one of the things you don't realize when you get on the board or when you're first going for the board seat is how involved it is. There are a lot of meetings. And there's a lot of, you know, research and things done in between. So I do want to recognize, and ironically, Juliana, my daughter, who is 16 years older than or younger than our oldest daughter, she was the same age as her when I first got appointed to the board. So, and now she is a thriving 26-year-old attorney living in Chicago. So it's interesting that, you know, how it's all just kind of come full circle. And again, thank you to my wife for the sacrifices that you make so that I can serve on this board and to my school board as well, all that you do to take care of our family. So thank you, and thank you again to the board, staff, and CEO.
Dr. Giles?
Wow. I have a lot to follow, so I'm going to say that I cannot repackage everything that you all said, but I definitely echo it. I wish you well. Thank you for the time served. Sorry I couldn't learn more from you, that you're leaving now, because I'm new to the board, so sorry about that, but I do wish you well. And that's all. Thank you.
And John Paul, certainly a pleasure serving with you, and best of luck in future endeavors. I know you'll be very successful and influential. And once again, thank you for the stories that inspire. They are always very inspiring, and it's always good to see somebody living as full a life as they want. And also, thanks again for the work that was put into the presentations tonight. Everyone have a great night. Thanks.
And I just want to thank the staff for the hard work that they do on a regular basis. It's an honor and a privilege to sit at this table and to be a part of something that's really making a difference in people's lives, as we can tell from our stories that inspire hope. It's worth all of the efforts, all of the sacrifices, everything that we do is worth it. So if there's nothing else, we've come to the end of our agenda, and the meeting is adjourned.